Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, Ms. Turner. Dr. Ahmed mentioned you've been experiencing some symptoms that led you to seek a consultation. Could you tell me more about what you've been going through?
Of course, doctor. It started with some tingling and numbness in my fingers, which I've had for a few months now. At first, it was only after typing at work or holding my phone for a long time, but recently the sensation hasn't gone away. I also notice my hands feel weaker, especially in the mornings. My grip strength is affected, and I even find it hard to hold a pen sometimes. Dr. Ahmed suggested it might be carpal tunnel syndrome, so he referred me to you.
The symptoms you described do align with carpal tunnel syndrome, which is often associated with repetitive wrist movements like typing. However, there could be other contributing factors, so I'll need to ask you some more questions. Have you experienced any other symptoms besides those in your hands?
Yes, I've had some gastrointestinal issues, like bloating and stomach cramps, that seem to come and go. It's hard to predict when they'll happen, but they usually worsen after meals, especially if they're high in fat. I also get sudden urges to use the bathroom, which isn't pleasant when I'm out. My appetite has been inconsistent, and I've lost some weight as a result.
These symptoms sound like irritable bowel syndrome, IBS, which can cause abdominal discomfort, bloating, and changes in bowel habits. Stress and certain foods can exacerbate it. Have you noticed any patterns with your symptoms?
I've noticed that stress definitely makes both my hand and stomach issues worse. My job is quite demanding, and I often feel like I'm running on empty. Sometimes my stomach cramps are so bad that I have to take time off work. I've tried eliminating different foods, but it's been hard to figure out what's triggering it.
Stress is a significant factor in IBS and can exacerbate many other conditions, including carpal tunnel syndrome. With the symptoms in your hands, arms, and GI tract, I want to ask if you've experienced any vision problems, fatigue, or muscle weakness elsewhere.
Actually, yes. I've had episodes where my vision becomes blurry or dim, and I sometimes feel extremely tired for no apparent reason. My muscles, particularly in my legs, have also felt weaker lately, which makes climbing stairs or walking for long distances difficult.
Blurred vision and muscle weakness could be indicative of a neurological condition, possibly multiple sclerosis. It's known for causing issues like weakness, vision problems, and fatigue, which can vary widely in severity. With these symptoms, I'd recommend we run some tests, including an MRI and nerve conduction studies, to get a clearer picture.
I see. I've read a bit about it, but I never imagined it could be what's affecting me. Is there a cure for it?
While there isn't a cure, There are treatments that can help manage the symptoms and slow down the progression of the disease. It's important to get a clear diagnosis so we can tailor a treatment plan specifically for you. This will also help in managing the carpal tunnel syndrome and IBS.
That sounds like a good plan. I'm just worried about how all these conditions might affect my ability to work and live normally.
It's understandable to be concerned, but early diagnosis and treatment can make a significant difference in managing the symptoms. We'll work closely together to address each condition comprehensively so you can continue living your life to the fullest.
Thank you, Doctor. I really appreciate your help.
You're welcome, Ms. Turner. Let's get started with the necessary tests and take it one step at a time. We'll work on a comprehensive management plan after that.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, Mrs. Johnson. I reviewed your medical history and the recent lab results you brought. How have you been feeling since your last visit?
Afternoon, Dr. Lee. I've been really struggling with my energy levels lately, and my stomach has been acting up. Sometimes after meals I get these awful cramps and they leave me feeling so weak.
That sounds tough. Can you describe the cramps in more detail? When do they start after eating, and how long do they last?
They usually start about half an hour after I eat. The cramps can last for hours, sometimes leaving me doubled over in pain. I also notice a lot of bloating and, on occasion, some diarrhea.
I see. Have you noticed any particular foods that trigger these symptoms more than others?
I've noticed bread and pasta seem to make things worse. I tried cutting them out, and the cramps eased up a bit, but they didn't go away entirely.
Your symptoms and history suggest the possibility of celiac disease. It's a condition where the immune system reacts to gluten, a protein found in wheat, barley, and rye. When people with celiac disease eat gluten, it damages the lining of the small intestine.
Oh, I see. Is that why I've been so exhausted?
Yes, it could be. The damage to the small intestine can affect the absorption of nutrients, leading to deficiencies and symptoms like fatigue. I'd like to confirm the diagnosis through blood tests and possibly a biopsy of the small intestine.
That makes sense. I'm worried about how to manage the disease if it's confirmed. Does it mean I'll never be able to eat bread or pasta again?
If the tests confirm celiac disease, the main treatment is a strict gluten-free diet. There are many gluten-free alternatives available now, so you can still enjoy a variety of foods. We would also refer you to a dietitian to help you with meal planning.
That would be helpful. Are there any other conditions related to this that I should be aware of?
Sometimes people with celiac disease also have other autoimmune conditions, like type 1 diabetes or thyroid disorders. We will need to monitor your health to catch any complications early. How about your thyroid? Have you noticed any changes in your weight, hair, or skin?
I have had some hair loss recently, and my skin has been really dry. My weight has stayed the same, though.
We'll include thyroid function tests to check for any imbalances. Also, because your fatigue could be related to thyroid issues or nutrient deficiencies due to celiac disease, it's important to get a comprehensive assessment.
I really hope we can get to the bottom of this. I feel like I'm constantly running on empty.
We will get there, Mrs. Johnson. Let's start with these tests, and we'll follow up as soon as we have the results. In the meantime, try to stick to the gluten-free diet as much as possible and keep a food diary to track your symptoms.
Thank you, Dr. Lee. I feel a bit more hopeful now.
You're welcome. I'm here to help, and we'll work together to improve your health.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Good afternoon, Nurse Parker. My name is Jonathan Miller, and I was recently diagnosed with type 2 diabetes.
Good afternoon, Mr. Miller. I understand that can be a lot to take in. I'm here to help you navigate this.
Thank you. My doctor mentioned lifestyle changes and medications, but I have some questions.
Of course. Let's start with your medications. Are you comfortable with your prescription?
Yes, but I'm unsure about the timing. Should I take them before or after meals?
It's generally best to take them before meals to help control blood sugar levels, but please follow your physician's specific instructions.
Got it. What about diet? I know I need to cut back on sugar, but what else?
A balanced diet is crucial. Focus on whole grains, lean proteins, and plenty of vegetables. Try to avoid processed foods and refined sugars.
I'll need to get used to this new routine.
It can be challenging at first, but we're here to support you. Have you considered meeting with a dietitian?
Not yet, but I think it's a good idea.
I'll arrange for one to reach out to you. They'll provide personalized guidance based on your preferences and health needs.
That sounds helpful. Thank you for your assistance.
Anytime, Mr. Miller. We're here to ensure you're on the right track.
Now look at question 26.
Hello, Nurse Martinez. I'm Oliver Benson, and I need some information about vaccinations for my upcoming trip.
Hello, Mr. Benson. Where will you be traveling to?
I'm going to visit several countries in Southeast Asia.
In that case, you'll need to ensure your routine immunizations are up to date, and you may require additional vaccines depending on specific locations.
I believe I'm up to date on my routine shots, but I'm not sure about the others.
For travel to Southeast Asia, we typically recommend vaccines for hepatitis A, typhoid, and Japanese encephalitis, depending on the specific areas you'll visit.
I'll be spending time in rural areas, so I assume it's best to be cautious.
Absolutely. It's also advisable to take antimalarial medication if you're visiting regions where malaria is prevalent.
I'll speak with my doctor about that. What else should I be aware of?
Make sure to drink bottled water, avoid raw or undercooked food, and use insect repellent to minimize the risk of mosquito-borne diseases.
That makes sense. Do I need any boosters?
If it's been more than 10 years since your last tetanus booster, I'd recommend getting one before you travel.
I'll check my records and follow up with my doctor.
Great. Safe travels, Mr. Benson.
Thanks for the advice, Nurse Martinez.
Now look at question 27.
I've noticed more patients and families are asking about hospice care earlier in their treatment.
Yes, it's an encouraging shift. It means they're becoming more aware of the importance of end-of-life planning.
It's important to provide them with compassionate support and clear information about their options.
Absolutely. Hospice care focuses on improving the quality of life for patients facing terminal illnesses, which can significantly ease the burden on their loved ones.
I often hear people confusing hospice with giving up.
Unfortunately, that's a common misconception. But hospice care is not about giving up. It's about ensuring comfort and dignity for patients when curative treatment is no longer beneficial.
I think there's still a stigma attached to it, and we need to help break that down.
Education is crucial. The more we inform people about the benefits of hospice, the more they'll understand it's about providing the best possible care during a difficult time.
You're right. We need to keep educating our patients and the community.
Now look at question 28.
Many of my patients with chronic conditions seem to struggle with medication adherence.
That's a common challenge. There are many factors that can make it difficult for patients to stay consistent.
Cost, side effects, and complex regimens are some of the issues I've seen.
Exactly. And sometimes it's simply a lack of understanding about the importance of the medication.
I've tried simplifying instructions, but it doesn't always work.
Sometimes patients need more direct support. Counseling sessions can help, as can mobile reminders or pill organizers.
I also think we need to have more conversations with patients about their concerns.
Agreed. Listening to their experiences helps us address the barriers they face.
Yes, especially if the barriers are emotional or based on misinformation.
It all comes down to personalized care. We have to meet patients where they are and provide the support they need.
That's true. It's a continuous learning process, but it's worth it to improve their health outcomes.
Now look at question 29.
Let's discuss young Liam Carter. He's a 10-year-old boy who was admitted last night for a severe asthma attack.
Severe? What was the severity on the scale?
His peak flow was below 50% of his personal best, which puts him in the red zone of asthma severity.
That's concerning. What treatment was given in the ER?
He received nebulized albuterol, followed by systemic corticosteroids to reduce inflammation. Oxygen therapy was also administered to maintain his saturation.
How has he been responding?
He's shown significant improvement. His breathing has stabilized, and his peak flow is now above 70%.
What about his medications? Is there a need to modify his asthma action plan?
Yes, the pulmonologist recommends increasing the dosage of his inhaled corticosteroids and adding a leukotriene modifier.
And any education for the family?
Definitely. They'll need training on how to use the inhalers correctly and understand how to adjust medications based on symptoms. We should also discuss avoiding potential asthma triggers.
Now look at question 30.
Mr. Henry Clark is a 72-year-old male with chronic lower back pain, possibly due to degenerative disc disease.
What treatment has he been receiving for the pain?
He's been on non-steroidal anti-inflammatory drugs, but they haven't provided enough relief. Physical therapy was also recommended.
Is surgery being considered?
His orthopedic surgeon hasn't ruled it out, but Mr. Clark prefers non-surgical options. We're trying to manage his pain conservatively.
Have alternative therapies been explored?
Yes, he's been introduced to acupuncture and aquatic therapy. He's also open to mindfulness-based stress reduction for pain management.
What about medications?
His pain specialist is considering a trial of nerve blocks to help localize and treat the source of his pain.
And any lifestyle modifications?
He's been encouraged to incorporate regular, low-impact exercises and maintain a healthy weight. We're providing nutritional guidance to support these changes.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Today, we have Dr. Sarah Collins, a clinical psychologist and expert in mental health from the United States with us. Dr. Collins, could you start by sharing some insights into the current state of global mental health?
Of course. Mental health encompasses emotional, psychological, and social well-being. It's crucial at every stage of life, affecting how we think, feel, and act. Unfortunately, mental health issues have become increasingly prevalent globally. According to the World Health Organization, about 1 in 4 people will experience a mental health issue at some point in their lives. Depression and anxiety disorders are among the most common mental health challenges with significant impacts on daily life and productivity. Furthermore, the stigma associated with mental health issues often hinders people from seeking help.
Why do you think mental health problems are on the rise?
There are several factors contributing to the increase. Rapid social changes, economic challenges, and increased stress from work and personal lives are significant contributors. Social media also plays a role, especially in younger generations who are exposed to idealized lifestyles and may feel pressure to live up to unrealistic expectations. Moreover, the COVID-19 pandemic has exacerbated these challenges, leading to heightened stress, anxiety, and isolation.
That's a lot to take in. How are mental health professionals addressing these challenges?
Mental health professionals are working diligently to meet the rising demand for support. Therapy and counseling remain the cornerstone of treatment, with cognitive behavioral therapy, CBT, being one of the most effective approaches. Medications are often used to help manage conditions like depression and anxiety. Additionally, there is a growing emphasis on holistic approaches, including mindfulness, exercise, and nutrition. Telehealth has also made therapy more accessible, allowing individuals to receive support from the comfort of their homes.
What recent advancements have been made in mental health treatment?
A significant advancement is the increased use of digital tools for mental health. There are apps and online platforms providing guided meditations, mood tracking, and self-help resources, offering support to individuals who might not seek traditional therapy. Furthermore, research in neuroscience is unveiling how the brain responds to different treatments, leading to more personalized and effective interventions. There's also a growing focus on early intervention, recognizing that addressing mental health challenges early can lead to better long-term outcomes.
Do you have a personal experience with a patient that illustrates the importance of early intervention?
Absolutely. I had a patient, we'll call him John, who was a bright young man but struggled with depression from a young age. His symptoms went unnoticed for years, with family and friends attributing his mood swings to teenage angst. By the time he sought help, his depression had severely impacted his academic and personal life. However, with a combination of therapy and medication, he was able to make significant progress. If John had received help earlier, his journey to recovery might have been shorter and less challenging. This underscores the importance of recognizing symptoms early and seeking appropriate support.
What steps can individuals take to maintain good mental health?
There are several practical steps one can take. Regular exercise is crucial as it releases endorphins that improve mood. A balanced diet and sufficient sleep are also vital. Connecting with loved ones and maintaining a supportive social network can provide emotional support. Mindfulness and meditation practices can help manage stress, and it's important to seek professional help when needed. Additionally, avoiding substances like drugs and alcohol, which can exacerbate mental health issues, is crucial.
What's your outlook on the future of mental health care?
The future is hopeful. We're seeing a positive shift in how society views mental health, with more open discussions and reduced stigma. Advances in technology and research are making treatment more effective and accessible. The integration of mental health care into primary care settings ensures more people receive the support they need. With continued education and advocacy, I believe we'll see a significant improvement in how mental health is understood and treated.
Thank you, Dr. Collins, for sharing your insights on this crucial topic.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hello, everyone. My name is Dr. Emily Foster, and today I'd like to discuss a prevalent yet often misunderstood condition, hypertension, commonly known as high blood pressure. By the end of this discussion, I hope to provide insights into what hypertension is, its implications, and how we approach its management in healthcare. So what exactly is hypertension? At its core, hypertension is a chronic condition where the force of blood against the artery walls is consistently too high. The heart pumps blood into the arteries, and the pressure that the blood exerts on the artery walls is what we measure as blood pressure. When this pressure is persistently elevated, it can lead to significant health issues like heart disease, stroke, and kidney problems. Hypertension is often dubbed the silent killer, because many people might not experience noticeable symptoms until severe damage has already occurred. Consider the case of John, a 55-year-old man with a stressful desk job. He doesn't feel any different, but during a routine checkup, his doctor finds that his blood pressure readings are consistently above the normal range. Further tests confirm that he has hypertension. For John, this diagnosis means understanding the potential risks of high blood pressure and how to address them through lifestyle changes and medications. Managing hypertension presents several challenges. For one, it's a condition that can develop gradually, often going unnoticed until it reaches dangerous levels. Additionally, hypertension is closely associated with other health conditions like obesity, diabetes, and high cholesterol, making it more challenging to manage when these conditions coexist. Also, stress and a sedentary lifestyle can further exacerbate the problem. When I approach a patient with hypertension, my initial focus is on understanding the severity of their condition and identifying any underlying risk factors. For John, this involves lifestyle modifications, such as reducing sodium intake, increasing physical activity, and managing stress. Even small changes, like substituting processed foods with fresh fruits and vegetables, can have a significant impact on blood pressure. Medications are also a critical part of hypertension management. Many patients will require medications to help lower blood pressure, such as ACE inhibitors, diuretics, or beta blockers. The right combination of medications depends on individual health factors, and regular monitoring is essential to ensure effectiveness and minimize side effects. However, patient education is crucial in managing hypertension. It's not just about taking medication. Patients need to understand how to monitor their blood pressure at home, recognize the warning signs of dangerously high levels, and make lifestyle changes to reduce their risk. In John's case, understanding the importance of consistent medication use and maintaining a healthy lifestyle has been key to managing his condition. Let's revisit John. After his diagnosis, he started taking his prescribed medications regularly, reduced his salt intake, and committed to a daily walking routine. He also began practicing relaxation techniques to better manage stress. With these changes, his blood pressure is now within a healthier range, and he feels more energetic and confident in his ability to manage his health. Hypertension is a common but manageable condition, especially if there is control over the coexisting associated health conditions, even though it is very taxing. As healthcare professionals, our goal is to equip patients with the knowledge and tools they need to control their blood pressure and reduce the risk of complications. And each time a patient like John achieves better health through effective management, it reaffirms the importance of our role in guiding them on this journey.